So we're going to begin our procedure today with marking. We use two small incisions. One is placed a little bit on the anterior aspect, one posteriorly, and through these two incisions we'll be able to treat the entire waist and low back area. We're going to do our marking, and we basically treat up to the level where her natural waistline is, feather it in around the back, toward the front, and then bring it down toward the underline. So we're going to get started here. We've numbed up our anterior little incision spots. Again, we make just a very small incision, basically about a ½ centimeter or so. And through these areas we're going to go ahead and start our infiltration with our Tumescent fluid, which is a numbing solution to keep the patient comfortable. So we're going to begin infiltrating here with a little bit of numbing fluid. Notice just a little bit of swelling up the skin. That's the numbing fluid going in. We're going to start melting fat here. Our laser's active. Everyone in the room has safety goggles on. And it's just a very smooth motion here. Basically let the laser do the work as far as melting the fat. You'll hear a little voice in the background that's telling us the temperature. That's just monitoring how hot we are inside and making sure that we're adequately melting the fat and not overheating the tissue. So now that we've got everything melted, we're going to go ahead and do a little bit of aspiration. Here's a very small cannula here, in through the same incision, and we just gently move it back and forth. Compared to traditional or standard Tumescent liposuction, the fat really just comes out much easier here. It's been melted. So I'm just going to show you here what that aspirated fat looks like. You can see that it's basically just a liquid. It moves very easily in the tube. And there's absolutely no blood cells here whatsoever. The laser actually causes those blood vessels to coagulate, and so we get very, very little bleeding with this procedure. This is what the skin tightening treatment is going to look like. Again, we're in the more superficial plane here. We have the 13-19 wavelength predominantly. Just basically going under and heating up that skin to induce a nice collagen response. So we finished our skin tightening. We're going to just pinch the skin now. We'll put a little drop of glue here to close our incision sites. Hold that for just a couple of seconds. That'll close up the incisions nicely. There's no stitches to take out. She'll be able to shower tomorrow.